Yes, with an arthritic knee, you can definitely avoid surgery. And really, surgery is the last resort. So I would consider the treatment for an arthritic knee a tiny bit like a step ladder, and there's a series of rungs, and it's only really the top rung that's an operation. So the sort of things you can do include optimizing weight. Weight is very important. If you're overweight, it will tend to make the symptoms worse. Making sure you exercise. There's very good scientific evidence that having strong leg muscles to support the knee help to keep the symptoms under control. Of course, painkillers, anti-inflammatory tablets, if you're able to take them. And these are all measures which make the symptoms of an arthritic knee more manageable. And so surgery really would be reserved when those measures have failed. During the operation of a knee replacement, you would need an anaesthetic, either a general or a spinal anaesthetic. There is an incision, a cut down the front of the knee, and then through that incision, the worn bone ends are removed. So part of the bone and the worn bearing surface is taken away, and then it's replaced with an artificial joint. The joint is sometimes fixed in with something called cement. It's not really cement at all. It's a little bit like the dentist filling material. Sometimes the prosthesis is fixed in uncemented, and the idea is that the bone grows into the prosthesis in that situation. Well, as I say, it stays in place really either one of two ways. The commonest way of fixing the knee in place is with something called cement. The cement is not really, as I say, a cement. It's actually a polymer. It's a type of bonding that bonds the back of the prosthesis into the bone. A second way is to use an implant that allows the bone to grow into the prosthesis itself. That's called an uncemented prosthesis. And then the bone grows in and fixes the knee replacement, the prosthesis of the knee replacement into position. In the UK, I think it varies a little bit from centre to centre. But it's approximately 12 to 14,000 pounds. That's not just the surgical fee; that's the overall cost of the operation on average. Knee replacement is a big operation. The first thing to say is that it's a painful operation, quite possibly one of the most painful operations people can have. I tell all my patients that, but at the same time, I also tell them that the vast majority of people look back and say it was worthwhile. So although they go through a period of pain and discomfort, when they come out the other side, they're usually pleased that they've had the operation done. So pain is obviously one complication. And then there are other serious risks, including infection. There's a very small risk of blood clots. That's called a deep vein thrombosis, a DVT. There's a very small risk of a blood clot going to somebody's chest. That's called an embolism. Sometimes people will develop a stiff knee after a knee replacement. And of course, there's a tiny risk of more general medical or anesthetic complications. And without wishing to frighten people, there is even a very, very small risk of death associated with a knee replacement. I warn all my patients of these potential complications, but at the same time, I ask them just to take it with some degree of context. That there's a risk, isn't there, when we walk across the road? And typically we look both ways and we step into the road and walk across the road without difficulties. So there's a risk really with most of the things we do, and we have to bear that in mind when we're considering the risks of a knee replacement.